no buts, no NHS cuts.
Demonstrating against job cuts, those who say their livelihoods hang in the balance.
For me personally, I'm one of the people that could be made redundant as part of this. I obviously am worried about what that means for my bills, especially at the moment. And every person that I speak to in my role as a rep was worried either what it means for them or what it could mean for the service they provide and our patients at the end of the day.
Cambridge University Hospitals has announced 500 jobs are at risk, mostly those in admin or clerical roles, porters, plumbers, engineers and others that don't directly provide medical care. Paul says his clinical engineering team, though, is a vital cog in the hospital machine.
All of these are vital roles. It means we can keep pieces of equipment in service. Without that, we would have to close theatres because we wouldn't have enough equipment within them.
And Mark worries surgeries will be delayed if his procurement team is slimmed down.
If we're not there to help them, they will just be completely delayed, delays after delays. Anytime soon, we'll hear about our jobs will go. It is a bit worrying.
No ifs, no buts, no NHS cuts.
Cambridge University Hospitals employs around 13,000 staff members. Now, a reduction of 500 jobs would equate to a reduction of 4% of the entire workforce.
But Unite the Union says the trimming down isn't logical because the population of Cambridge is growing and so too are the hospitals.
We're going to get 2 new hospitals. There's a cancer hospital and a children's hospital on this site, and if they cut admin staff, then they're just going to have to rehire a bunch of admin staff in 5-10 years to cover those roles in the new hospitals.
The worry is that those who are left will have to pick up a bigger burden of work when they're already stretched and maxed out as it is.
Cambridge University Hospital Trust is not alone in needing to make the cuts. It's a national mandate for NHS trusts to reduce support staffing. A spokesperson said, "We're taking all possible steps to minimise redundancies through natural turnover by not recruiting to posts when staff leave, holding vacancies empty and a mutually agreed resignation scheme."
No administration cuts.
But staff say they're not only worried about their jobs, but the impact on patients too, in a system that's already at breaking point. Rosie Dowsing, ITV News, Cambridge.
Well, let's go to Westminster and our political correspondent Emma Hutchinson. Emma, good evening. What's the government saying in the face of these protests today?
Well, we did ask the Department of Health for a response to those protests today at Addenbrookes, those potential redundancies. We haven't yet heard back from them, but what we do know is that the government say the NHS budget has increased over the past year. It's now around £202 billion for day-to-day spending on Department of Health and Social Care activities. And we also know that that budget is protected, so any money savings made by making cuts or redundancies would be kept within that NHS budget.
And Emma, this comes as the Chancellor prepares to set out spending plans for the next few years.
Yes, that's right. This time next week, Rachel Reeves, the Chancellor, will set out the spending review, which sets out departmental spending for the next 3 years or so. And this morning, she was saying that there will be some tough decisions to be made. Speaking to MPs from across the region, they've got a very close eye on what's coming up, and they've set out what they would like to see in that spending review.
There's 2 things that are really important that I'm pushing on. Firstly is extra spending for our National Health Service. It's the top issue that people right across my constituency bring up with me. It's great that we've got the funding to build a new hospital in Milton Keynes, but we need to ensure that we've got enough funding for the doctors and nurses to continue getting NHS waiting lists down. Secondly, right across the region, we're building lots of new homes.
Well, the Chancellor has made her job herself, made it very much tougher. She caved into public sector unions, give them very large pay increases, for example, for junior doctors, who've now said they want to have even more money, more higher pay again, 30% potential demands for additional pay. All of those things go to squeeze the amount of money that's available for other departments.
So lots of difficult decisions for the Chancellor as she approaches setting out that spending review. All eyes here at Westminster next week will be on what she has to say and whether, if there is a further increase in NHS, in health spending, whether that will mean other public services might face having to make savings.